So what do you do to help being sure that you're getting everybody who's eligible? Do you have a tip or something to how do you capture people?
I capture them by actually keeping, and most of you probably do have an oncology history. I see what date they were diagnosed. Well, more than that, when they started one of the when they started their endocrine therapy. So based on that date is when I present. About 4 years later, 4.5, depending on how their appointment falls, to review that with them and see if that's what they would like to have moving forward, to give them that absolute yes or no if they would benefit.
So Mayra, we were talking last night, and you had a little different approach in your EMR on how you capture people and who you order it for.
Yes, I have a treatment table, and the treatment table tells me when did this happen, like for example, chemotherapy, when did the surgery happen, when did they start the endocrine therapy, and then I have a stop date, that's blank, until we decide when that's going to happen. And as I see the patients, I look at that date of start, figure out year 3, year 4, and depends on the patient itself how much difficulty being compliant they have, and bring the subject of PCI to again do several things for me or for the patient, to encourage them if they are going to have a low, and also to encourage them if to be compliant if they have a high and they need to be on it for 10 years. So that's the point where I do it.
So I do mine at the 4.5-year visit. I'm very fortunate I work with a single physician, so it's just 2 of us managing all the patients versus 10 or 12. I know some of you are in different situations. And so our agreement is to be sure at that 4.5-year visit that we've gone back and we've looked at our table or our history when they first started their endocrine therapy, thinking that this is probably the time, and usually we order it then, and that helps us capture everybody who is eligible. So that you can start the conversation anytime. I don't usually see patients on their first visit, but oftentimes on their second visit, and I start laying the groundwork because they're already saying, how long do I have to take this drug? And certainly we see a few people that have no side effects, but certainly most of them have got something that's bothersome. Mm-hmm. And then again, in about that 4th year, somewhere in there, we order BCI, and we get that individual percentage risk in addition to whether or not they have benefit for a total of 10 years.